Waking up at 3 a.m., drenched in sweat, you can't fall back asleep, you're tossing and turning for hours. If you're in your 40s or 50s and sleep suddenly feels impossible, it's not in your head, it could be perimenopause, and you are not alone. I'm Dr. Karen Tang, I'm a board-certified OBGYN, and today on Healthline, we're gonna talk about why perimenopause and menopause cause problems sleeping and what you can actually do about it. Let's get you some rest. In this video, you're gonna learn what happens with your body during perimenopause and menopause that's messing with your sleep, how hormones like estrogen and progesterone affect your circadian rhythm, real practical tips to help you fall asleep and stay asleep, plus real medical options to talk with your doctor about. If that sounds like what you need, keep watching. And in general, for more information about sleep and perimenopause, make sure you sign up for the menopause newsletter in the link below. So perimenopause is the transition period leading up to menopause where your ovaries are quieting and they're producing less in general of the hormones estrogen and progesterone. This can start as early as your late 30s, more often in your 40s. So what does this have to do with sleep? Estrogen plays an important role in temperature regulation. So dropping estrogen levels can cause things like hot flashes and night sweats that can actually wake you up from sleep. This is where people wake up drenched in sweat, their pajamas and their sheets are totally soaked. Progesterone also has a calming effect on the brain. It's almost like nature's own sleep aid. So when progesterone decreases, people can have trouble falling and staying asleep. Decreasing and fluctuating hormone levels can lead to things like depression and anxiety, and these have been closely linked to problems with sleep. So all those nighttime wake-ups are not normal, they're hormonal. When my patients talk to me about sleep, I often hear the same patterns over and over again. I wake up drenched in sweat, even if my room is freezing cold. I might be able to fall asleep okay, but I wake up at 2 or 3 a.m. and I just cannot get back to sleep. I just feel absolutely exhausted during the day, but then I feel wired at night and I can't sleep. These symptoms aren't random. The primary culprits are your hormones and how they affect things like your melatonin production, or even sensitivity to common sleep disruptors like alcohol, caffeine, or even screen time. And sleep is actually so essential for many other aspects of your health, including your mood, your memory, and even your weight and metabolism. But there are real practical ways that we can break the cycle of poor sleep and poor health symptoms. So let's talk about what you can do starting tonight. Here are some evidence-based lifestyle changes that I recommend to all my perimenopausal patients. First, keep a consistent sleep routine even on weekends. This will help regulate your internal clock. 2, make your sleep environment a little bit cooler. Aim for 60 to 67 degrees Fahrenheit. And that is key for managing hot flashes and keeping your core body temperature low. Avoid caffeine after noon and alcohol in the evening. This is really important. People think that alcohol will help them sleep. It's actually the opposite. It can disrupt your sleep. So both caffeine and alcohol can disrupt REM sleep, especially in perimenopause. Shut down screens at least 60 minutes before bedtime. The blue light can affect your melatonin production, which is the sleep hormone. Consider a calming bedtime ritual. This can include journaling, deep breathing, reading. And it sounds cliche, but actually these mindfulness practices actually really do make a big difference in winding down your nervous system at the end of the day. And don't underestimate the power of consistent movement during the day. A brisk walk, gentle yoga, or strength training can actually all promote better sleep at night. Now, sometimes lifestyle changes just aren't enough, and that's okay. That's the reason that there are medical options that can help. So first, hormone therapy. If the main issue affecting your sleep are hot flashes and night sweats that are waking you up in the night, the most effective treatment for those are estrogen-containing hormone replacement therapy. Other medications that can help include things like low-dose birth control, antidepressants, certain sleep aids, and melatonin, which can help regulate your sleep-wake cycle. But obviously, make sure you talk with your doctor about the risks and benefits and what's right for you. If you're looking for a non-medication method, there's cognitive behavioral therapy for insomnia called CBTI. So this is a proven, evidence-based approach that changes thoughts and behaviors that could be affecting sleep, and has been shown to actually significantly improve your sleep. So if you've tried all the lifestyle modifications and everything you can at home and you still cannot sleep, please do not suffer in silence. The punchline is, if you're having a horrible time sleeping, you're not just stressed, you're not overreacting. These sleep issues are biological and they're incredibly common during perimenopause. You're not alone and you're not powerless. I'm Dr. Karen Tang, and hopefully you try a few of these tips tonight. Let me know how it goes. And if you found this helpful, make sure you like and subscribe for more evidence-based health content. And make sure you share your story. If something worked for you, if you have any questions, leave them in the comments. Your experience matters, and together we're gonna make this transition a little bit easier. So thank you for watching and wishing you a restful night ahead.